before we go on to the detail, I mean, what you're describing is a cure, not by some sort of rather lily-livered definition of a cure, something that halts it, or something that actually reverses condition.
Yeah, I'm not sure I'd say a cure, because a cure is getting rid of the underlying cause. So if I could get rid of the underlying cause that drives Parkinson's, say the protein aggregation or whatever, that would be a cure. What I'm talking about here is actually repairing a bit of a brain that's gone wrong.
How would
Bringing you back to normal.
Putting it back to normal, yeah.
How
So
would you get the replacement cells back in?
you just inject them.
Well, I think we're going to go into some detail on that now.
Once the woman's agreed to have a termination of pregnancy, subsequent to that, the tissue is used for medical research, and we would dissect out the bit of brain that contains the developing dopamine cells, and then you transplant that into the brain. And in the best cases, what that would mean for the individual is that their dopamine levels in the brain went back to normal when you scanned them, that they came off all their medication. And so there were 2 patients in the UK who had these transplants done in Sweden who 30 years after they had their transplant were on no medication, had a motor score on a standard scale that was less than when they presented to their neurologist 30 years previously.
My God, It sounds like a miracle.
And so these patients, it was clearly transformative. I mean, you know,
So it's as good as a cure for them, really.
it was as good as a cure.
Yeah.
I mean, I'd be splitting hairs to say it wasn't a cure.
Yes.
Yeah.
That limited number has been discounted because the cohort was, what, 17, you said? But it seems to me that even if you've got one, then it must work.
Yeah.
And so why has it not been pursued?
Yeah, so it's a very good question. So I had an argument with a
I didn't put it very
statistician
well, but I
from
don't know what
NIH
I
about
mean.
this, because he said, could this patient have a placebo effect? And I said, well, it could be a placebo effect. And if that placebo effect puts someone back to normal for 10 to 15 years to normalise their
Pretty
dopamine
damn
levels,
good.
I don't really care how it
free as
works.
well,
I said, so you're absolutely right. So I think what they showed is it's a proof of concept. It can work. Now, in order to make that a viable therapy going forward, you obviously can't have 1 in 8 people getting a good benefit. You've got to make it more consistent. And so it was on that and even if you look at the studies in America where they didn't get the positive outcomes of their trial, if you looked at the trials in slightly different ways, you could see that some of the patients clearly had improved from it.
I'll take 1 in 8.
Yeah, but you know, I mean, I'm still. It's the conceptual thing. Rutherford split the atom 1 in 50 times, but 1 was enough.
Yeah.
And 1 was enough to show it can be done.
Yeah.
And then
So-
you take it forward.
But what the argument would be was that these patients who'd done extremely well, these 1 or 2 patients that I was mentioning, the people who'd done the randomised controlled trials in the States would say that's all a placebo effect, that's all investigator bias, that's not a real effect. Now it's hard to argue that when you look at a scan of someone's dopamine levels in the brain and they've gone from being 1/10 of normal back to normal.
So it can't be placebo because there's been this restoration of the amount of dopamine.